A patient today was interested in non-pharmacological treatments for their OCD, specifically obsessions and compulsions related to contamination and germs. They really wanted to try to use a form of psychotherapy or use some tools that didn't involve medication management. And I thought that this was really reasonable, and I commended them on being open to putting the time and the work into doing so. So what we talked about was CBT, or cognitive behavioral therapy. And we talked about actually writing out a list of things that make them anxious, that they have to do or they might want to be able to do, that then affect their life in a negative way, things that they wanted to work on. And I took a big step back and I said, why do you want to do this? Why does this matter to you? And they said, well, the main issue is that I avoid certain situations with friends or family where we're going to eat out in public. And sometimes when I go to a restaurant, if I do go and I'm not avoiding it, which is hard, but if I do go, if I have to use the restroom, I'll actually hold it to the point that I feel pretty sick and uncomfortable, and I'm worried that I might actually hurt myself by doing this. And I thought, wow, that there really is quite a bit of motivation there. And I thought that this was great, that this was, certainly there was a lot of motivation. This was a reason why the person wanted to work on this. And these were important things to try to help this individual with. So what I had them do is write out, again, a list of of a good number of different stressors or triggers where they felt that their anxiety response or their physiological response of anxiety would be triggered. And they wrote out things like picking something up or touching this from the sidewalk, or touching the sidewalk, touching a doorknob in a public place, using a public restroom, and actually touching a toilet seat in a public restroom, touching a toilet seat at home, and a couple of other items. And then what we did was there's a method where it's called a subjective units distress scale, or SUDS, where you have the person actually write out for each one of those triggers the numerical value that they would give towards the anxiety that they would assume that they would feel by doing that, by being triggered by that event or that situation. So, for example, touching a doorknob in their home, they said that would cause a little bit of anxiety, but maybe like 5 out of 100, with 0 being no anxiety and 100 being just the most extreme anxiety they could imagine. Touching a doorknob in a public place like a restaurant, that would actually probably give them about a 40 or a 50 out of 100. Touching a doorknob in a public bathroom, they thought that would give them about an 80 out of 100 or an 85 out of 100. Actually going into a restroom and adjusting the toilet seat up or down, they thought that would give them 100 out of 100. The idea of doing so just made them feel incredibly distressed, made them feel kind of shaky at the knees just talking about it. And so I had this individual write out all these different events and then assign that SUDS value to each one of those events. And then we said, all right, what we're going to do is in between sessions, I want you to 2 or 3 times a week start off on the easiest of these and basically do it over and over and over again until you start to get bored. And I don't want you to distract yourself. And this is really important. So what we chose as the first item here was them touching a doorknob in their own home without going and washing their hands right away. So I said, when you go and you touch that doorknob in your home, I want you to be thinking about the fact that you're touching a doorknob. That doorknob could be dirty. There could be germs on that doorknob. If you notice that you're trying to think about sitting on a beach somewhere and having a pina colada, I want you to move your thoughts right back to the fact that there are germs on that doorknob and you are touching it and you are not washing your hands. And what will happen is that that person's anxiety, as you're touching that doorknob, will go up and up and up and up. But then after sitting there and holding a doorknob in their home for 5 minutes or 10 minutes or 20 minutes or 45 minutes, they're going to start to get bored and they're going to start to think, wow, this is kind of stupid, to be honest. I'm holding a doorknob in my house. I've been standing here for 45 minutes. And then their anxiety will start to break. Their anxiety will start to come down. And by doing that over and over again, you become habituated to the anxiety or to the anxiety response of that specific trigger, of that specific stressor. And you teach yourself, you condition yourself that to bring down your anxiety, you actually just continue to do that thing that you were uncomfortable to do in the first place. So then after doing that for a few weeks, touching a doorknob in that person's home really becomes no big deal, and then they can move on to the next item in their hierarchy ladder. And so in this case, it was actually touching a doorknob in a public place, in a public restaurant, not the bathroom yet, but just the normal entrance and exit door. And so with some of these exposures, you have to be careful because it can look a little bit odd if someone is opening and closing a public restaurant's front door over and over and over again for 45 minutes. Eventually, the police may be called, or the hostess might ask you if everything is okay. And so the plan for this was for the person to basically walk down a really busy street, so Walnut Street or Sansom Street in Philadelphia, and kind of walk in and out of different restaurants as if they're going to go check out a menu or just see what it looks like inside, and continue to do that without washing their hands in between restaurant and restaurant, and to do that until they started to get bored of doing so. And then to repeat that several times a week for several weeks until basically they were habituated from their anxiety response caused by touching doorknobs in public places. After doing that for a few weeks and after starting to become habituated to doing that and being bored from doing that, suddenly not only does that become a lot easier and a lot less anxiety provoking, but when you think back about the touching a doorknob in your own home, suddenly the person would likely start to realize that they weren't even thinking about that anymore. That became a joke, touching a doorknob in their own home when they had been touching these doorknobs for public restaurants over and over and over again without washing their hands. And then once that becomes boring, or once you become habituated to that, then you move up to the next item on the list, and that may be using a public restroom doorknob or picking something up off of a dirty floor or something of that nature. And so that is a form. This is all we're talking about: cognitive behavioral therapy. We're talking about exposure therapy, which is a type of cognitive behavioral therapy, or it's within cognitive behavioral therapy. The idea of exposing yourself to the anxiety-provoking event or trigger, and doing it over and over again until your anxiety starts to come down and until you become habituated to having that anxiety from that response. And then suddenly, the hope is that that individual will be able to, over time, pretty easily, or at least without too much distress, enjoy a nice dinner at a restaurant with their friends and their family. Thank you for watching the video. If you have any questions, be sure to reach out to a mental health professional to discuss that at a visit.